Good evening, everyone. It's 6 p.m. and it is time for some MCQs. MCQs, we are going to see some mixed MCQs. It is a mixture of the embryology topics, some of the general anatomy, and some things that are quite simple, but some of them will really make you think and answer. So, variety of MCQs we are going to look at today. Every day at 6 p.m. in the evening, we are going to have a session with the MCQs, which is going to be of medium difficulty. So this is medium difficulty, and there is a session at 9:30 p.m. So 9:30 p.m. is going to be a scenario-based one. So that is going to be of a difficulty level will be a little high. So what we are going to do, we'll have a session which is of medium difficulty, because this will give you a motivation to if you have answered something nice and clear concepts are clear, you will be able to attempt the one which is little tougher. Otherwise you will get demotivated, according to me. So it is always important that you get motivated to do well. So we have two sessions, one at 6 p.m. This has got medium difficulty. And there is this 9:30 p.m. MCQs that is again scenario based, mainly clinical. Scenario based, all the clinical cases we discuss, and this one is going to be of not much difficulty. So we have two of them. There are two, one at 6 and one at 9:30 p.m. So I would urge you to participate in both of them for you to understand maximum and get maximum out of it. Okay, we have Ultra Clan who says good evening, and we have some of the students who are watching right now. So I welcome you all. And I also have a session at 10:30 that is going to be a special class. Actually, this is a special class. So it is either 10:30 or 10:40 it is. It is at 10:40 p.m. So kindly join in for the special class, because always we discuss some important topic. So this will be an important topic discussion. So the topic discussion, everything will be made known to you, or you will get a notification provided you have Learners app. So having a Learners app is going to be advantage to you, because you would be getting a notification on the upcoming class. So this notification is important, because according to that, you can plan and schedule your learning timetable. And you're talking to Dr. Rohini. I have about 10 years plus experience in India and abroad. So I have worked in USA, and I have taught many aspirants from NEET, MCI, lab, etc., including USMLE. So all these aspirants I have taught them. And then there are many examples, or many scenarios and cases where the students have bagged very good seats, and that should give you a motivation that you are talking to an educator who can really guide you. So follow me at ROHAQUA, ROHAQUA. My code is ROHINI. So you can just, the YouTube link, whatever you are watching, there is a small drop down there. So go to this drop down, click on this. You will get set of links that you can go to. So there is a link that says there is a link that says, let me just show you. Okay, how to follow. That is Dr. Rohini, how to follow. You can just go to the ROHAQUA is my username. You can click on the drop down. it will take you to the link, and then it will take you to my profile. That is one thing. And then you can also subscribe. You can subscribe to Unacademy, and then you can get lot of notes, PDF notes, and then you can also get a lot of discussion topics. And then you can use my code, that is ROHINI, to avail 10% discount on your subscription. So that subscription will give you the plus classes. So these plus classes are loaded with material. It is going to give you 100% coverage of all the topics. So that is what is important, and that is what you should look for. And then you also have this link for learning app, and then you also have batches, when the batch updates, when the next batch will start, and what batch is currently running. All these information is there with the link. And then you can also watch a playlist of, if you follow some educator, you can get a playlist, all the classes that is conducted by that particular educator. That way you will have everything in hand. You don't have to go searching by the topic. You will have the playlist with you. With the playlist, you can definitely look for all the classes. So let's start with the first MCQ. Okay, now first one, let's see how many of you can answer these. Now we have SK, we have Rishabh, we have Divakar Vora, and then we have Shrija, and we have Ultra. And the first question says the cells in the blastocyst are. So who can answer this question? What are the cells in the blastocyst? Blastocyst is the stage when it is at 5th or 6th day. So you tell me, what are the cells that is in the 5th or 6th day? What type of cells? What is the shape that is taken by the blastocyst? Who can answer this question? Anyone? Let me make sure that people are able to see. Okay. So we have Ramya who says A, and SK says C, VIP says A, Shrija says C. Everyone has different, answers. So who says A? Okay, Vidyashri says D, and some people say trophoblast. What are the cells? There are two types of cells, to give you more hint. There are two types of cells. What are the cells? Okay, let's see the answer first. The answer is C. Okay, you have two types of cells. You can see that there is this inner cell mass, which is also called embryoblast. I think you forgot about the inner cell mass. The other name for embryoblast is inner cell mass. So you have the answer, yes. Yes, clan, that is inner cell mass. So you have a zygote, which is again male and female pronuclei. You have the 2-cell stage, 4-cell stage. You have 8, 16, and then 32. So 16 to 32 together, you can consider that as morula. So from morula, it becomes the blastocyst. Now here you also have a blastocele. This is the blastocele. The outer rim of cells are known as trophoblast cells, and the inner portion is known as the embryoblast. And this trophoblast cells is what is going to become the placenta. Okay, so it is again going to divide into syncytiotrophoblast and cytotrophoblast. Cytotrophoblast and syncytiotrophoblast. These are the two things that you can see. All right, let's see. Next one. So the answer is C. Okay. So that is first week of gestation. You must remember what week we are in. So now next one. The question says the transformation of the neural plate into neural tube is called. What is that called? Transformation of the neural plate into neural tube. So there is mitosis, there is meiosis, embryogenesis, and neurulation. What is the answer? Anyone? What is neurulation? All of you think it is neurulation? Yeah, the name itself gives you a hint. Anybody knows what is embryogenesis? What is embryogenesis? See, genesis is the formation of the embryo. That is again the formation of the yolk sac, right? So that is embryogenesis. Neurulation is formation of the neural tube. Okay, let's see whether the answer is correct. Yes. See, what happens here is there is a bilaminar germ disc and there it is going to turn into trilaminar. The folding process in the vertebrate embryos, it includes the transformation of neural tube that you can see there is this neural tube into the neural plate into the neural tube. So neural plate, you can see here, this is a neural plate that turns into neural tube. So at this stage, the embryo at this stage is termed as the neurula. Okay, so now what happens? Now it starts as a bilaminar disc and then that turns into trilaminar because of the migration of the cells. So now here you can see that there is this mid-sagittal groove appears as a result of invagination of the ectoderm. So ectodermal cells, they invaginate and you see the groove here. And then simultaneously, there is also elevation of this is the ectoderm. You can also see that there is an elevation of the ectodermal tissue on the sides. On both the sides, you can see there is elevation. And that forms two folds that is known as neural tube. Ultimately, it turns into a tube and that is known as neural tube. Okay, so that is the answer. So we have Divakar, Ramya, Ultra, SK, all of you. Vidyashri, Shrija, everyone is answering this as D. Okay, you're right. All right, there is a small thing that I wanted to mention. See, one thing is very important when you discuss and learn, when you do things in a manner which will motivate you and keep you together. See, now that the classrooms are not there, all we have is virtual classrooms. You should not think that you are the only one who is going to write the exam or face the exam or the one who is going to be in this kind of a mental situation. There are a whole lot of people with you. So we are with you, the educators are with you. So it is always important that you follow your educator, take guidance and just do your job right. Then you can see the success. So now here, one thing you can do is follow the educators. You want to get good marks, then please follow the educators. That way, half of your work is done. You will be able to get all the notifications for the class so that you don't get to miss any class. All the important topics which are covered, you will get it on time. And then subscription to plus subscription is very important. Once you have plus subscription, you will have access to 100% material that is uploaded by the Unacademy platform. Okay, let's move to the next one. The trilaminar germ disc. The trilaminar disc includes, what does it include? See, tri is 3. So it is also called gastrulation. The process is known as gastrulation. And what does it include actually? Anyone? What do you think it includes? Okay, anyone who can answer this question? Is it ectoderm, endoderm, mesoderm, or all of the above options? Okay, let's see the answer. See, the answer is D, because at third week of gestation. So when was the first one? We had this first thing, that was first week of gestation. What did we see? We saw the blastocyst, right? And then after that, the second week up to 8th week, we see all these processes, that is neurulation and gastrulation, all these happen at the 2nd to 8th week. So this week is very, very important point to note down. So now here the formation of the trilaminar germ disc that you can see here is known as gastrulation. So now here you can see that there is this line, that is proliferation of the epiblast cells. So epiblast cells, they proliferate or they multiply. And some of them migrate to the caudal end, and that there is a line that embryo always starts developing from the craniocaudal end. Okay, so now there is a groove that is present from cranial end to the caudal end, and this groove is known as primitive streak. So now primitive streak, here you can see that there is cranial end, there is a node that is known as primitive node. So it is marked by a primitive node that you can see, and then you can also see that the cells start migrating between the two layers, that is epiblast and hypoblast. So now there is this epiblast layer proliferates and then differentiates at the primitive streaks and migrates between these two. So now this is the epiblast and then this is the hypoblast cells. Okay, so there are two layers, epiblast and hypoblast. In between that, the cells, you can see that they start migrating. Okay, now this gives rise to three layers. So the cells that have migrated will form mesoderm. At this stage, because it has three layers, it is known as gastrula. And gastrula is made up of three germ layers, that is epiderm or the ectoderm, mesoderm, and the endoderm. All right. So all of the above is the answer. Next one, we'll move on to the fourth question that tells you head and neck region. It develops from which portion? It mainly develops from what? Head and neck region. Anyone? Head and neck region? Head and neck region. Is it from the germ layers? It is not from the germ layers. It is not from germ layers. Then it is from where? It develops from something called the, is it lingual swellings? What is lingual swellings giving rise to? Anybody knows? What does lingual swelling give rise to? Tongue. Yes, all of you say it is tongue. So lingual swelling gives rise to tongue. Tongue, do you know from where it develops? Tongue develops from which arch? Which arch? Which arch? Tongue develops from first arch, then the third arch, and the fourth arch. Yes, anterior part of the tongue as well as the posterior part of the tongue. Who said second arch? Shrija, it is not second arch. Second arch does not give rise to tongue. No tongue. No structures from the tongue are derived from the second arch. Very, very important. This is a very important answer for your NEET PG. Then what it gives rise to? It gives rise to muscles of facial expression. That's it. It does not give rise to the tongue muscles at all. So Yes, the third one overgrows. You are exactly right. So the third one overgrows the second. And third one also has this tonsil. And thymus. We'll talk about all this. Tonsil, thymus, all these are from the pouches. We'll talk about all this. What is pharyngeal arches, pharyngeal pouches. We'll talk about all these things, but you must remember the second one does not contribute to the tongue at all. So that is one important thing to note down. Okay, let's go to the next one. So the answer, what is the answer? The head and neck region develops mainly from, the answer is A. The answer is A. So here you can see every arch will have a set of muscles in nerve, in artery, and skeletal derivative. It will have so many things. So now here, all these are present with every arch that is associated with the arch. Now you can see that there is the artery of the first arch, there is an artery for the second, third, fourth, and so on. You can see there is nerve, there is cartilage. So every arch will have a nerve. It will have a cartilage. And then it will also have set of muscles. So that you can see here in this arch. So first arch, what it gives rise to, second arch, third arch, everything is given here. And then each arch has its neural, vascular, and cartilage is given. And then arches are grooved by clefts on the external surface. On the internal surface, there are pouches. All these are pouches. Okay, what you can see outside, these are the clefts. Okay, so now we'll go to the next one. This question is, the squamous part of the temporal bone is derived from. The squamous part of the temporal bone. Where is this derived? Is there anyone who has any idea about the skeletal structures derivative? So squamous part of temporal bone is derived from. Is it from the first, second, third, or the fourth arch? Let's see if there is anyone who has any other queries or so SK thinks there is a question. He is still thinking whether it is the first arch, first pharyngeal arch. Anybody else who wants to try this on answering this? The answer is correct. A, that is the first arch. You're right. You guessed it, but it is right. See now here, the pharyngeal membrane, there is ectoderm and the endoderm. They contact, regions. Only the first pair persist as tympanic membrane. The first pair will persist as tympanic membrane. The first arch, you do know that it is a mandibular arch. And then there are, it has two prominences. There is the smaller upper, larger lower. So lower one is, simply remember lower jaw. Okay, simply remember lower jaw and you remember mandible. This is my trick to remember this. So this is a trick or strategy to remember this. So lower jaw you remember and you remember the mandible. Okay, so this is the one which is presented by the lower part and all other bones. Okay, so all other part. So just knowing that it is from the first arch is not sufficient. You have to know whether in the first arch, is it from the upper prominence or the lower prominence. The upper prominence, all other bones. And the lower, you remember lower jaw for mandible. And lower jaw, if you remember, you'll remember the large lower part gives rise to mandible. Okay, so this is a very important question. So now here, the first arch can have a lot of congenital defects. Like you can see that there could be defect in the eyes, it could be in the ears, it could be in the palate, or could be the jaw. So most of the things that associate with the Appert's syndrome. Have you seen the people with Apert syndrome? Anybody who has seen the people with Apert syndrome? Yes. Anyone? Anybody who wants to answer this question? What is Apert syndrome? What is Apert syndrome? What happens? What is the main, striking feature that you can see? There is muscles, or the anomaly is with the development of face. That's the first thing. The person will have a beaked nose. And then there is also micrognathia. What is micrognathia? That is to do with the mandible. Yes, craniosynostosis. That is one important thing that you can see in the Apert syndrome. Other than that, the other features, if I want to relate it to first arch, what is the first thing that I can identify? The mandible. Mandible is what I can identify with this. Okay. So the first arch defect, all these defects you can see in the Apert syndrome. All right, shall we move to the next one? The next one is, so if you have understood and if you are able to connect with the clinical aspects, the theory with the clinical aspects, please hit a like. So your like and appreciations are very important to me so that we can do better. So just like you, we also get motivated and we can do better. We can bring in more good questions, more good discussions, provided we get likes, appreciations, and subscriptions. So please subscribe to all my videos and watch all the playlists so that you get benefited through your view and we get benefited because you viewed the videos that we have posted. Okay, so expecting few people to. Yes, thank you so much. We have good likes and that is definitely appreciated. Okay, next one. Mandible is derived from which cartilage? Now, there are so many cartilages in the thing, but there are cartilages which are present for the development into the bony structures. So we have this Meckel's cartilage for the first one arch. The second arch has this Richard's cartilage, and that is for the second arch. So which one is developed from the mandible is developed from which cartilage? Anybody? Anyone knows? Okay, many of you say it is Meckel's cartilage, and Meckel's cartilage, where it is present. Anybody has an idea? It is near where there is this foramen that is called mandibular foramen. This is where the inferior alveolar would divide into buccal and mental. This is exactly where you have the Meckel's cartilage. Okay, Meckel's cartilage. And you should also remember that the body of all this, the portion above this area is by the Meckel's cartilage. Now this area is by the Meckel's cartilage up to here. And then there is this small portion here near the symphysis menti. And that has this endochondral ossification. It's very important you remember this. Next one, we'll move to the answer. That is, this is where the Meckel's cartilage you can see. You can also see that it gives rise to other structures like the malleus and the incus. So all these are the derivatives from the first arch. So the ones which are in blue color are the derivatives from the second arch. All these are from the second arch. See, please see, there is only lesser cornu of the hyoid bone from the second arch. Okay. Next one. All of these are involved in development of face except. So all these processes are developed in the development of face. All these processes are involved except for which one? So you have the face which has all the 5 processes. So think of all those 5 processes. Which one does not belong? You have to remove the odd thing out. Which one is the odd one that has to be removed? Anybody has an idea what it is? It is the pterygoid process. SK says it is pterygoid process. We have the frontal process and medial nasal process. Similarly, lateral nasal process. And then we have mandibular process. And then we have maxillary process. All these 5. What is the odd thing that is out? Pterygoid process. So, pterygoid process has nothing to do with the development of the face. So, pterygoid process, that is lateral and medial pterygoid muscle attachments, right? Where in which bone this is? This is the sphenoid. So this is in sphenoid bone. It has got nothing to do with the face. See, whenever you learn something, you should always make sure that you have understood, and you have to make sure that even the wrong answer, you should know why it is wrong. Unless you know why the answer is wrong, how will your mind accept it? You will not accept it that you have gone wrong or you have picked the right answer unless you know even that this odd thing, why it is the odd thing, why did you pick? You should know the complete information on it. Okay, now that we know it is belonging to the sphenoid bone, which is a part of middle cranial fossa. So it has got nothing to do with the face. Okay, so that will stay in your mind and you'll remember it better. Okay, next one. So this is how it looks. You can see the frontonasal prominence, maxillary process. There is this oral cavity. You can see mandibular process. All these processes you can see. You can also see medial nasal process and lateral nasal process with the small nasal pit. So all that, the medial nasal process is what is going to form the philtrum. This is a very important NEET question. Which one forms the philtrum? Philtrum is the gap between the nose and the upper lip. So this gap is known as philtrum. So that portion is very important. You should know from where it came. It came from the medial nasal process. Okay, so that is the part of medial nasal process. You see what happened to the lateral nasal process. It forms the ala of the nose. So the sharp nose, short nose, the nose that is little deviated, all these, everything is because of medial nasal process. So culprit for good nose, bad nose, you can blame it on the medial nasal process. Very, very important. Okay, next one. So next the question says, non-fusion of lateral nasal and maxillary and lateral nasal. What happens to it when it doesn't fuse? Non-fusion of lateral nasal and maxillary process. So lateral nasal and maxillary process. Anyone? Anybody has an idea what this could be? Let's see the answer. Is it cleft palate? Is it cleft lip? Oblique facial cleft, or none of these? Who has answered it right? SK says it is oblique facial cleft, non-fusion we are talking about. If it doesn't fuse, then what can happen? See, this is the one. Oblique facial cleft. This is from the angle of the mouth up to the medial angle of the eye. This is the medial angle of the eye to the angle of the mouth. So this line you have to remember. So it results from failure of the maxillary process here with the lateral nasal process. So these two processes, when they don't fuse, the lateral nasal and maxillary, then it results in oblique facial cleft. So similarly, you also have this picture which shows you cleft palate. It leaves this nasal oral cavities, okay, connected like this. And this also results in feeding and nursing problem. So now here there could be the foramen, that is incisive foramen, that could be absent. If it is bilateral, then there could be on the both the sides there could be problem. Otherwise, there is only one-sided incisive foramen present. Okay. Next, cleft lip is due to non-fusion of these processes. Now, lip, they're asking, cleft lip is due to non-fusion of these processes. So, which ones? Anybody? Okay, we have options as medial nasal process and maxillary. We have the option lateral nasal process and maxillary. Then there is frontal and maxillary, mandibular and maxillary. So it is, I don't think it has got anything to do with the frontal at all. So eliminate the one which is wrong. And then think what is near the lip, which area, that is maxilla is definitely there. Other than that maxilla, what could be there? Is it medial nasal or lateral nasal? The debate is between these two, right? So let's see. The A, answer is A. Many of you answered. Shrija, SK, Priyanka, Prabhakar, you all are right. It is A. See now here, this is the thing. You can see that there is medial nasal process. Remember the philtrum I told you. Philtrum is formed. That's why I told you philtrum is very important thing. So it is formed by medial nasal process. I have mentioned this. When I have already told you this area is medial nasal and this area is the maxillary. So it has to just join in. Otherwise it will leave a gap here. So medial nasal process plus maxillary. So that results in non-fusion will result in cleft lip. It could be unilateral in most of the cases, that is 80%, or it could be in, it is most common in case of males as well. It just goes with the affinity to that male Y chromosome, and it is on the left side. So remember all this, left sided is more common, male is more common, and unilateral is more common. And then next one, next question, let's go to, okay, we have body of the tongue is contributed by. Now we have this tongue which has anterior portion, and then we have the sulcus, and then we have the posterior portion, and then we have this root, right? So this is the anterior 2/3, this is the posterior 1/3, and this is the root. This is where your epiglottis will be present. So this is where you can see also the palatine tonsil. Okay, so now anterior 2/3 is formed by two structures. They're called the lingual swelling. So this is one lingual swelling. There is another lingual swelling. And these two lingual swellings are present. And there is this thing called tuberculum impar. And these are called the lingual swellings. Now they're talking about the body of the tongue. That apex of the tongue is this one. What about the body of the tongue? Now let's see, this is the body of the tongue. So body of the tongue is formed by which one? Now they're not talking about in terms of anterior 2/3 and posterior 1/3. No, they're not talking about in this term. They're asking you body of the tongue. So anybody who wants to attempt this, think and answer. I just mentioned they are not talking about anterior and posterior. So this is apex. Okay, so now let's see what is the answer. Answer is A. So answer is A. Now here the formation of the tongue, the body of the tongue is formed by around the 4th week it starts its development. Okay, so now you can see that there are 3 swellings. One is this lateral to lingual swellings, and then there is a triangular swelling that is called tuberculum impar. Okay, so now what happens here is these 3 things, they form and grow rapidly during the 5th week, and they form the front body of the tongue. So these 3 together they form anterior 2/3. And then this later on, the tuberculum impar, it doesn't give anything else other than that it just contributes to the formation. It is just a elevation. It's just a elevation. There is no other structure that is derived from the tuberculum impar. So that is the answer. Okay, next one. When can the cleft lip palate abnormalities could be detected? What age it can be detected? Cleft lip and the palate abnormalities. So all this will have some, developmental milestones. So there could be first week, some things could be in the second week, which can be detected. So there is cleft lip palate abnormalities, depends on when it starts. Now in the previous slides, we saw 5th week, 6th week. So 5th week is which day? You go in terms of day. The 5th week is which day? Okay, if the week is given, you have to know what day. How many days is 5th week? 4 weeks is about, okay, now you please see day 17 is A option, day 18 to 23 is B option, day 19 to 28 is C option, and day 50 to birth is the D option. What do you think is the answer? So all these are your options. You please think and tell me what is your answer. So let's see. Okay. Now here you have, there are so many, probabilities. You have the answer as C, which says the day 19th to 28th here. Okay, let's see. This is the thing. You have all these things, 19 to 28, but is the option should have been D. The answer is D actually, because this is the option which is not given. So it should be this option, that is 28 to 38 days, that has cleft lip, palate and other facial clefts. So now here you please keep these two in mind. There is Treacher-Collins syndrome and there is hemifacial microsomia. These two things also you keep in mind because it is equally important. Okay, so that is 19 to 28 days. Now 17 days you can easily identify fetal alcohol syndrome. So this is one thing. Anencephaly at 18 to 23 days, and then cleft lip, cleft palate, all this you can identify at this weeks, that is 6 to 9 weeks, 6 to 9 weeks of development. So since it is a range that is given, it is a little tricky because each book may not follow the same thing, but you have to go with the options. You just see what is the option and then you go with the option. Okay. Next one. What type of epithelium? What type of epithelium is seen as flat cell? Now there are so many types of cells. Which one is flat? Which one is cuboidal, columnar, stratified? Now this one is got this kind of appearance. And this one has this kind. And this one has this type. And there is stratified. Okay, Ashok says it's A and Shrija says it's A and squamous. Okay, most of you pick it as squamous cells. Do you know what is the function of each one of them? What is stratified? Stratified is for protection. What is the example we can give? The buccal cavity. Digestive, that is esophagus. Columnar we can give for protection again. I would say gallbladder. And I will also say that there is one more thing, gallbladder and the large intestine. Cuboidal will say that cuboidal is the one which has function secretion. So secretion is from the cuboidal type of cells. So you will see all these follicles like the thyroid follicle. So follicles, acini, all these are ducts, sweat glands, sweat ducts. All these are lined by cuboidal type of cells. Next, you also have this squamous type. Squamous type is really flat. Flat one for the exchange, because you don't want very thick cell. It will not be possible to exchange material. So it could be between the blood vessels and the alveoli. So that is the squamous variety. So now because of all these functions, you can pick the right kind of epithelium that is present in various regions. Okay, this is the flat variety. You can see this is squamous. Next one. In which type of cartilage are the chondrocytes arranged in a row? So you can see that the chondrocytes are arranged in a row. So you have elastic cartilage where it is scattered. Then Meckel's cartilage is for mandible development. And then hyaline where there is cell nest. Where do you see them in a row? Where do you see them in a row? No. No SK, you're wrong. It's not arranged in a row. In case of row, that is horizontally placed. White fibrocartilage. Shrija is right. She says white fibrocartilage. Do you know where it is present, white fibro? It is present in symphysis. Anything that says symphysis. Then disc, menisci, IV disc, for example. The menisci. All this. Then articular disc. All these are nothing but white fibrocartilage. What is absent in them? Perichondrium. Perichondrium is absent. Next one. This is how it looks. You can see them arranged in a row. What fibers are these? What fibers are these? They run parallelly. What fibers are these? These are collagen. Do they branch? No branching. There are varieties of collagen fibers. There is type 1, type 2, type 3. So if you want all that, examples, there is a chapter on connective tissue. I have a topic on connective tissue that is uploaded. Please subscribe, go to that and read about it. The connective tissue, cartilage is the chapter name, cartilage. And you can see the various types of cartilage, the various types of fibers that are present. Everything is given in detail and it will make things even more simple for you to understand. Once you have gone through this topic, then you will be able to answer all the questions. So that is, there are different types of connective tissue. In that, one of them is cartilage. And there are 3 types of cartilage. And this is white fibrocartilage. Okay. Then there is this sub. Okay, we'll move to the next one. Okay, now all these are part of the epidermis of the skin. So now except which one? Now we have to find the one which does not belong, right? Does not belong. Which one does not belong? We have stratum basale, we have spinosum, granulosum, lucidum, corneum. Are these part of the epidermis? Yes. Papillary layer. Papillary belongs to the second layer. This is dermis. Epidermis is the first layer of skin. The second layer is called dermis. And dermis has a papillary layer and other layer is reticular layer. So this chapter I have about skin or integumentary system that is uploaded. It is on YouTube. Please go through this chapter and learn more on these topics. You can learn more. You can have complete information on the layers of epidermis, different type of cells that are present in epidermis, and then different layers in the dermis and what is their function, what are the appendages of the skin. All that is discussed in detail. Next one. This is the answer. We have corneum, lucidum, granulosum. Granulosum is the one which has granules. Lucidum is absent in thin skin. Okay, it is absent in thin skin. So this is the first layer, second, third, fourth, and fifth layer. This is the one basal. It is also called germinatum because it can germinate or it is can multiply. How it can multiply? By mitosis. That is the answer for next one. The actin and myosin are part of which muscle? So now there is actin filaments and myosin filaments, thick filaments and thin filaments. So which one is thick? Which one is thin? Which one is thick? Anybody, anyone has an idea which one is a thick filament? Adya says A, and yeah, answer is A. That is right. Actin and myosin are part of electron microscopy of skeletal muscle. But which one? The thin one is actin and the myosin is the thick filament. So you have a smooth muscle, cardiac, and involuntary is the cardiac muscle. Okay. Next one, the involuntary muscle is also the smooth muscle. Next, the answer is the difference between actin and myosin. You can see that the filaments that are present here, the thick filaments are the myosin ones, the thin filaments are the actin ones, and you can see that actin is what forms the I band, and the dark bands, A band, is formed by myosin. So you can see that in between that you can also see the line. Okay, you can see the Z line or Z disc you can see. And this is a very important model. It is known as the electron microscopy. Only with this you can visualize all these filaments. And this theory is known as sliding filament theory. And this tells you about the contraction or sliding of the thick filaments or the thin filaments, and the distance between one Z to another Z is known as sarcomere. That is a unit. That is 1 unit. That's how the contraction is brought about in the muscle. Okay, we'll go to the next one. That is Haversian system. We are talking about this muscle now. We are talking about bone right now. That is Haversian system. Now, it's a feature of which type of bone tissue? Is it a compact bone, spongy bone, subchondral bone, or long bone? There are two types of bones, compact bone as well as the spongy bone. Both of them are present in any long bone you take, it's present. But Haversian system is present where? The Haversian system is also called one osteon. Osteon is the other name for Haversian system. And inside the Haversian system, you have a central canal. Where do you see this kind of arrangement? Spongy bone has all this trabeculae. All that trabeculate has, and you can see this Haversian system in A, that is the compact bone. So you can see there are lamellae around it. So you can see the concentric, the ones which are going in concentric rings like this, and you can see the ones which are interstitial lamellae, which are outside, which are not part of this ring. And then there are so many cells inside. You can see all these cells, and then you can also see canaliculi. You can see the gap, that is lacunae, and you can also see this Haversian canal you can see, and it is all present in the matrix material which holds these cells. These are called osteocytes. There is an important chapter on bone cells. There is an important chapter on bone cells, which is a very, very important chapter. This is done in my YT. YouTube video, and please go through that bone cells to know what are osteocytes, what are osteoblast and osteoclast, and how the osteocytes contribute to the bone. What is their function? Which one has major function, which one does not have any function, and which one is stationary after certain time. All that you have to know. So, and that is present and that is given in this particular chapter about bone, and that is already uploaded in my playlist. Please go subscribe first. Subscribe and then like. So once you do this, you will be able to watch all the videos that is uploaded by me, and then you will get a hands-on, material, that is study material itself you can get, and then you'll be able to answer all the questions that is posted during this MCQ session. Okay. Now we also have another class that is coming up at 9:30 that is going to be purely clinical based questions. This was all general, and that is going to be clinical, more of clinical, and it will also cover a lot of embryology questions. So please look forward for that. It is very interesting and very interactive. You can read up some embryology and come for this, and that is at 9:30 p.m. every night. That is on YouTube, and it's a free class. So log in for my class at 9:30 p.m. And with this, I would like to end this session and continue again these kind of scenario based questions, that is rapid quiz at 9:30. And then we also have at 10:40 another class that is called special class, which is a topic again. So look forward to seeing you all at the time.